For most people, breathing is so basic to daily life that we don't even give it a thought. But for some older adults, breathing becomes problematic and may signal a health issue that needs attention.
Poppy, what's wrong?
Here, let us help you to a chair. What's going on?
It's nothing. I'm just having a little trouble catching my breath, that's all.
Clearly it's not nothing. Has this happened before?
Sometimes. It always goes away when I stop and rest.
Pappy, I think we need to take you to the doctor. This doesn't sound good. Is anything else bothering you?
I do cough every day and can't seem to walk too far without having to take a break.
Come on, Poppy. We'll take you to the hospital and get this checked out right now.
Okay, but don't say anything to your mother.
Abuela.
Yes, but just one. Now go outside and play.
Mom, you don't sound too great. Are you having trouble breathing?
It's nothing. Just a cold that won't go away.
You've had that cold for a long time now, and it's not getting any better. Besides, it sounds deeper. You're wheezing.
Ay, mija, I'm fine.
Actually, now that I'm taking a closer look, something does look off. You're paler and you've lost weight and you're still struggling to catch your breath.
Mom, this might be something more serious. I really think you should go see your doctor and make sure you're all right. I'm happy to go with you. Let's call and schedule an appointment right now.
Shortness of breath, coughing, wheezing, chest tightness, especially when you exert yourself, these may be symptoms of COPD, chronic obstructive pulmonary disease. While smoking is the most common cause of COPD, it can also result from long-term exposure to secondhand smoke, air pollution, or chemical fumes. COPD is a chronic disease, meaning once you've got it, there is no cure. But there are ways to prevent it and keep it from getting worse, which is why it's so important to diagnose it as early as possible. COPD typically includes a combination of emphysema and chronic bronchitis. Emphysema causes loss of lung tissue, making it difficult to breathe after exerting yourself, and in some cases, even while resting. Chronic bronchitis causes swelling and consequently narrows our breathing tubes. People with chronic bronchitis struggle with persistent coughs, often with phlegm. Over time, both of these conditions may get worse.
Poppy, aren't you glad we went to the doctor?
It's a relief to know you're not having heart problems. It may not be good to have COPD, but at least it's something treatable.
Yes, it's worth knowing I can do something to help catch my breath. And maybe I can finally make it to the top of the stairs before your kids now.
Diagnosing COPD is relatively simple. Your doctor will give you what's called a spirometry test, asking you to take a deep breath and blow air as fast and hard as you possibly can into a tube connected to a handheld device. The device then measures the amount of air and speed at which you blow out of your lungs, helping to determine whether or not you have COPD and its severity. Fortunately, there's a lot of things you can do to deal with and prevent COPD from worsening, from simple steps like stopping smoking, getting more exercise, and eating healthier, to medications, breathing techniques, improving the air quality in your home, and, in extreme severe cases, oxygen and other respiratory therapies. Knowing the truth about your lung health is vital and can be a relief.
Mom, you seem to be doing better now that you're taking the right medicine and making healthier choices. How are you feeling?
See, mija, much better, and I'm coughing less.
You're so important to us, and we don't want to see you hurting or struggling.
Take charge of your health if you're living with COPD. Get the facts and see your doctor. The sooner you do, the sooner you'll be able to take a breath. Tome un respiro.